Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of facial rejuvenation. I do a lot of body contouring surgery, and we really try to maximize your results, and we try to maximize tissue healing. And people often ask, Dr. Shapiro, do I have to stop smoking? How does smoking affect the healing process? Does it adversely affect the healing process? So the answer to the question is yes. And I try to educate people about what it is and how smoking affects. Basically, smoking makes it so the blood does not efficiently release oxygen to the tissues. And of course, tissues need oxygen to heal well. So after surgery, if you continue to smoke, you really increase the risk of healing complications. So that could look like, bad scars. It could look like separation. It could look like, some other untoward results that we didn't expect. So with that in mind, I will tell people I need them to stop smoking for 2 weeks before surgery and 2 weeks after, and I really try to live up to that. That's so important to me that I actually have you sign a contract, stating that I have stopped smoking. And in patients that, let's say I'm doing something like a facelift or a tummy tuck, a big tummy tuck, oftentimes I will have someone do some hyperbaric oxygen before and after surgery. It's not uncommon for me to have them have a treatment in a hyperbaric chamber a day before surgery, and then usually about 4 or 5 treatments after surgery. And how does that work? Actually, it's concentrated oxygen that makes that blood release the oxygen to the tissues much more easily. So it tries to cancel out that effect that the smoking has done, on your bloodstream. Now, you really can't reverse the smoking effects, but you can try to minimize them by stopping smoking. And we can counsel you about that. Oftentimes, I will have patients, put off their surgery until they feel like that they can stop smoking. And we really try to coach you about that in terms of maximizing your result. So the answer to the question is yes, smoking is very deleterious to cosmetic surgery. It makes it so the tissues don't heal well. You can have more complications in terms of wound separation, bad scars, and tissue loss. So it is something not to be taken lightly. There are things that we can proactively do, like hyperbaric oxygen. The best way to get an idea is to come in for a consultation. We'll come up with a plan with regards to maximizing your healing. We may do some hyperbaric oxygen. We may prescribe you something to help you stop smoking, and then put off the surgery until we feel that you can effectively meet that commitment. So the best way to get an idea, come in for a consultation. We'll talk about it. Thank you.